Hi, we're going to be looking over Chapter 9, Management of Injuries and Acute Illness. So let's take a look at that. So, responding to an emergency. So an emergency involves an unexpected event or condition that requires a prompt response. So remember, those of you working with children, there may be times of emergency and responding. I know that has happened to me working with children, young children. I had one little boy who fell off the bars, and then when he got up, he kind of passed out. So the teachers were really afraid that maybe he hit his head or something, but no one saw him hit his head. But he was bleeding by the mouth, and so again, that was a very scary situation, having someone pass out. So I did call 911. They came, and actually they said that he bit his tongue, but it wasn't too bad. But the little boy saw the sight of his blood and most likely passed out. So kind of funny but scary at the same time. But again, it's better to be safe calling 911 in case of emergency than not. So again, you will be expected to do a prompt response if needed. Also, program planning is part of being safe. So every program should have policies and response procedures in place to follow in the event of like an illness or serious emergency. So again, these plans should have a program planned, somewhat of a procedure in place. So maybe this might include items for teachers to follow. For example, protocol for an illness, like when should they be sent home. There should be a parent handbook and also a staff handbook in place so that you will know these procedures and follow them. So staff should be familiar with these plans and know how they are to be implemented. So program planning part 2, staff members should be trained in basic first aid and CPR. Per licensing, there should be at least one person in every classroom that is basic CPR and first aid certified. I personally feel every single staff should have their first aid and CPR certification, and this is usually every 2 years. And first aid supplies should be available and accessible both indoors and outdoors. And families should be informed of program emergency response and policies and procedures. Again, this should be put in your handbook, the parent handbook. Also, emergency policies or emergency exits should also be posted at every single door in a classroom, describing where children would go in case of an emergency, earthquake, or fire. So the basic principles are: remain with the child at all times. Do not move unless there is danger of further injury. So if a child falls, breaks their leg, try not to have them get up. Just leave them there and then have the proper, person or calling 911. Or if there's anything, more serious, then you just leave the child there. And do not give fluids or medications unless prescribed. Call for medical assistance. So again, there might be some time that you may need this. And again, It's always okay to call 911 if ever you feel like a child is in danger or has hurt themselves pretty good. Don't worry about calling 911. That is their job, to come and make sure the child is safe. You'd rather be safe than, sorry, I guess you could say. And notify the child's family if something happens. For the child's safety, record all information about the event. Most schools have a long form if some child, got a concussion or broke their leg or arm or something. There's usually some type of long form that will need to be done. And that's good too. Record all information for your backup and also for parents. Evaluating the victim. So once you evaluate them, you assess the child and the environment. Are they in a safe location? If they're not, you would move them to a safe location. You alert another adult. You attend to the victim. And then record all observation and treatments. And never attempt to diagnose or give medical advice. For example, like, I know they broke this or they did that or they need stitches. Really, it's not our diagnosis. It is a medical professional. But you're just stating you feel like that child needs to go to the doctor, get medical attention. So absence of breathing, check for victim if they're breathing, and for injuries. Establish that the victim is not breathing. You begin CAB, which is chest compressions, airway, and breathing. So again, you give 3 quick chest compressions. Open the airway, tilt the head, give 2 small breaths. So again, you continue that. You're going to definitely call 911. And, make sure that there are, medical emergencies on their way. Airway obstruction, for example, like choking. Children under 5 are at higher risk for choking on objects. That's actually #1 thing. Children choke on toys, #1, and food. So why are they at a higher risk of choking? Their teeth are just coming in if they're younger. 5 years old, they might not be sitting down or rushing, or they put things in their mouth. So there's lots of different reasons. What other groups of children are in increased risk? And then again, that would be even lower ages. The older kids that are at risk, maybe because they have developmental delays or special needs, maybe another increased risk group of children. And what items do children choke on most? Like I said, it's in our chapter 9 book. It lays out all of the different types of choking hazards, but again, toys and food. And you may have to use the Heimlich maneuver to dislodge an item. Again, if you know the procedures for infant, toddler, and older children. That's why everyone should take a CPR class, because it definitely shows you what to do. Again, this would be in this picture as an infant blows and thrusts on the back if they had something and stopped breathing. There's shock. Shock is a life-threatening, and it can occur with many different types of injuries, falls. The victim may appear pale, weak, and confused. And if that happens again, they definitely need medical attention. So help the victim lie down. Elevate the feet up 8 to 10 inches and observe closely for breathing. Call emergency medical assistant. And that basically happened to that little boy that I told you about that fainted. He did go into somewhat of a shock. Asthma, Many children have asthma, which is the cause of swelling and narrowing of the air passages, like this picture shows. They can't get air in as much as they need. A lot of times children do that mild coughing, or you can hear wheezing. And then, of course, the next stage would be they can't breathe. So asthma rates for children 5 years have increased to almost 160%. There's different reasons why they think this, due to environment, hereditary, and some other things. But boys are diagnosed more often than girls. Children 5 to 17 years miss a lot of school days due to asthma. And also, many children do have the inhaler on hand, which is doctor prescribed, to help alleviate that. Encourage the child to relax if they're having an attack, which this did happen to me. I had them bend over and just breathe and calm them down. If they have an inhaler, administer that. Monitor their breathing. Call for emergency medical assistance if the attack prolongs or the child becomes fatigued. And you can see that struggling of breathing. Notify the child's family. Bleeding. Call for medical assistance if the bleeding becomes spurts and cannot be controlled or stopped. Again, you apply pressure to that spot to help stop the bleeding. And then, of course, you're going to call 911 if it was something really excessive. Notify the family. Diabetes is another area that some children do have. That's maybe diagnosed with type 1 diabetes. Type 2 is linked to obesity, and so children need to be, kind of monitored. But type 1 is where they would need the shot or check their insulin level daily. And diabetes is a major trigger for heart disease and stroke, and is the 7th leading cause of death. And then again, lots of type 2 diabetes. The highest of these groups are among the African American, Hispanic, Latino, Native Americans, and some Asian Americans. Native Hawaiians and Pacific Islanders have the highest risks. And then again, teachers must work closely with families of children that have diabetes and what to recognize. So again, if you look on chapter 9 checklist, 9 and 5, it will go into the symptoms. And again, you would know, hopefully, the child what they need. If they're hypo or hyperglycemia, what does that mean? Again, you can look on chapter 9. And sadly, drowning is one of the leading causes of death among children under 14. Prevention is essential. So definitely watching children around water is number one. So really through supervision. And again, you would perform CPR if someone was not breathing and call 911 immediately. Head injuries should be considered potentially serious. So anytime a child hits their head, you definitely need to contact the parent. Make sure you let them know what are the warning signs. Dilated eyes. Don't become familiar with their surroundings. They may vomit. Poisoning also. Children that are a higher risk. And then there's different, table 9-2 shows different categories of maybe poisoning that children may have been exposed to. Non-life-threatening conditions may be injuries. How would you respond to each one of these? Scrapes, cuts, bites, blisters, burns, and eye injuries. And there's different ones. Again, chapter 9 is full of different injury prevention and how to control them. Thank you.